My name is Nita Shoemaker. I'm a pediatrician from Chattanooga, Tennessee, and I started being interested in PLC because I was involved in leadership in our local medical society, Chattanooga Hamilton County Medical Society, but also because I was involved in leadership at Erlanger Medical Center, which is a level 1 trauma center. I have been chief of pediatrics and had been chief of staff, but wanted to go to the next level, realizing that other people are making decisions about medicine, and physicians are not necessarily always at the table and not involved in those decisions. So PLC was a wonderful way to get me to think differently about the political arena and know how to approach and be comfortable approaching the legislative delegation to affect change in our world, which protects us, but also, and most importantly, protects our patients and their interest in this changing healthcare field.
You know, as physicians, we are just inherently perceived as being leaders in the community because of our position in caring for people. And oftentimes our education in leadership is limited in the training that we've gone through in medical school and residency. And most of our leadership skills are gained by mimicking or seeing the people that train us and taking the good points and, you know, sometimes the bad points of their leadership style and incorporating that into who we are. But formal leadership training is often missed. And although I was in the Army and got a lot of yes sir, yes ma'am kind of leadership training, it didn't seem to bode as well in the civilian world for me. So when I moved back to my home area of Southeast Tennessee and just took on the role of being a participant in professional medical organizations as a good Army officer would, I knew that I needed something different, some formal perhaps training in leadership in the medical field or leadership in general.
It has actually made a much bigger impact on my life, my career, and my practice than I ever would have thought. I'm very fortunate in that the director of my medical society suggested it to me. I didn't realize that PLC existed, and then when I looked in my community and my state, I realized how many graduates were making an impact. I have used the skills in every part of my practice with my patients, with my staff to make my office a happier place. I have used it with administration in terms of negotiating, and also in my community to get colon cancer awareness raised so that we can make an impact and have more patients screened.
I became much more confident in dealing with administration, more confident in myself in terms of putting myself out there for leadership roles and being more willing to get involved. And I think it's been a great growing opportunity for me. And not only that, I really feel motivated to get other young physicians, or not so young, other physicians involved in leadership going forward.
And I think one of the things that it's helped me with is actually to become more of a community leader. It has helped me with some of my leadership positions that I hold with some of my volunteer organizations. And I guess built my confidence, poised me to handle things like conflict resolution, and so it was very valuable.
Hi, I'm Pete Powell. I'm from Franklin, Tennessee. I was in the very first Physician Leadership College class. I really enjoyed it, and I really encourage many people that want to get involved to do that. It was a great experience for me. I actually didn't know a lot about it when I was getting involved, but it was going to teach me a little bit more about the TMA and exactly what was going on in the state for me to start understanding things a little better. Well, after that, I've now not only been the delegate for my region, but I've also been a board member for 5 years and the treasurer for 4 years. So I really think that the PLC teaches you what's going on, what you need to know, and I think it engages people. And I really encourage you to get involved because I think it's going to help you understand what the TMA is all about and the potential of it. I wasn't really interested in getting involved with the board, but after doing the PLC, I understood what was going on in the state. And it really fired me up to do something, and I hope it does the same thing for you.